do that.
No problem.
Welcome to the Health Hub with Dr. T. I'm Dr. T. As always, I give my disclaimer, right? Everything you hear, everything you see on this page is general information only. If you have specific questions for yourself, for your loved ones, for your family, please, please, please reach out to your healthcare provider. Like I said, this is general information. We don't diagnose, we can't do a treatment plan. We can just give general information and have you be educated enough to go ask specific questions to your healthcare provider. So, with that being said, I want to welcome a very, 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 very dear friend of mine, Dr. Gloria Odum. She's going to introduce herself. So, go ahead and introduce yourself. Tell us what you want us to know about you, and then we'll kind of get started from there.
Oh, thank you so much, Dr. T. I am so happy to be here today. Thank you for the honor of inviting me to be at the Health Hub with Dr. T. Yay! So, I'm Dr. Gloria Odum. I am a physician. I specialize in mental health, so I am a psychiatrist. I have been in practice now for over 10 years, and I am based in Houston. I see patients virtually as well as via telemedicine. I just opened a private practice a couple of weeks ago, which I'm really excited about. www.gloriaodummd.com. So that's where patients can find out information about my clinical services. I also work in the mental health hospital sometimes. I used to do that job full time, and I've transitioned now to seeing patients out in the real world in the outpatient setting. So that is kind of what I do clinically. I like to also provide psychoeducation to residents, medical students. I do a lot of teaching and mentor a lot of people, pre-medical students as well. I like to, I haven't done as much in recent years, but I do a lot of community engagement, meeting in churches and just community centers, talking about mental health, trying to spread the word about advocacy and having people kind of, day-to-day people understand what mental health symptoms could, look like, what to spot, how to get treatment if they need to. So yeah, that's me in a nutshell. Happy to be here.
Awesome. Thank you so much. This month is, as we know, Mental Health Awareness Month. So it's very fitting that you are here because typically you are the top of mental health. And I know there are different categories when it comes to mental health, like counseling, psychology, and all of that. But I want to get a little personal first for me before we get started. I really want to give kudos to mental health providers because I am not a mental health provider. I am a healthcare provider, but I'm not a mental health provider. And
Mhm.
there's so many different, there's such a difference. Life has been life into a lot of people in my community. And I have just been a listening ear to people. And I remember Saturday, and it's been going on for about 2 to 3 weeks, right? And I remember Saturday, I had to go be a listening ear again, and I came home and I like crashed, and I
Wow.
was like, I am emotionally exhausted.
Wow.
Like
Wow.
that's how I felt, right? I was
Mm-hmm.
just kind of like, it's a lot. Like
Mm-hmm.
and it's, these are people that have been there for me. And so
Mm-hmm.
it wasn't even a second thought to be there for them and to listen to them. But it was so emotionally tasking. So, watching you as a mental health provider, kudos, because how
Thank
do
you.
you manage? You're managing everyone's emotions,
Yeah.
and it's
Yeah.
like, how? I'm just listening.
I appreciate the kudos. I definitely think for all mental health providers, and like you said, there's a lot of us in the system. I feel like we're an ecosystem of mental health care providers, clinicians. It does take a unique kind of special skill set and a heart for the work.
Right,
The work is not easy. So I think first and foremost, you have to be able to have, empathy, a
yeah,
surplus of empathy to be able to care for the person that you're working with or treating, and then a skill set to be able to kind of do what you're doing well and competency to do well. And so, we have psychiatrists, psychologists, all different levels of therapists. We're all in the system,
right.
and my hats off to everybody that does, has a piece of the pie. And I tell a lot of, I know you're saying you're not a mental health provider, but I guarantee you, Dr. T, you are providing some kind of mental health support for all of your patients because
Yes.
mental health, the sad part about it as a psychiatrist, I don't really see a lot of people like I would like to see, right? It's a little harder to get
Mm,
in with the psychiatrist, just availability and resources. And so a lot of times the first line for people who are dealing with mental health issues is our other clinicians, right?
mm,
PCPs, they're nurses, nurse practitioners, PAs, physical therapists, right?
yeah.
Other clinicians. And so I always like to tell and empower other clinicians like, no, you are doing something as part of that ecosystem too. So hats off to you for the little that you
It
do in showing empathy. It's not easy.
it is not easy because my sessions with my patients are long. So my patient, they're typically 55 minutes.
Oh, wow.
Yes,
Mm.
depending on the insurance, but majority of them are 55 minutes. And oh,
You're gonna get an
I
earful.
hear everything, right? And then I end up hearing like, oh, Dr. T, you're a great therapist. I'm like, I'm not that kind of therapist. So I do refer. I am
Yes.
huge on referral because
Good.
I let them vent because that's what I call it. It's not a
Yes.
session. I
Yeah.
let them vent, but I'm like, you can't just vent and think this is okay. Like I need you to see someone to help you with this.
Yes.
So I
Yes.
solely believe in referrals because it
Good.
is
Good.
1000% outside my scope, and I don't
I
even want
love
it.
that.
I
I
don't
love
want it.
that. And that's your part in the ecosystem, which I feel like gets dropped sometimes, I think is important, is that you're able to hear that and be like, I think you probably need to see a professional. And they've already trusted you, right? They've
Yeah.
opened up their heart
Yes.
to you. They feel like they can share some of their innermost things with you that they're probably
Yeah.
not telling other people. And so you being in the opportunity to say, I have this referral for you. That actually
Yep.
increases the chances of them following up with the appropriate people to get the care that they need. And so hats off to you, girl.
Yeah.
That's right.
100%. I do a lot of referrals. I've even gone as far as going to the provider's website and scheduling their appointments in my session. Yeah. Oh
Wow.
yeah. Like there's so many, even if they're looking for, like I say, a lot of postpartum too. So I'll do that
Hmm.
for their OBGYN. If they're looking for
Yes.
one, I do the same thing for a PCP, I do for a psychiatrist. I'm like, you
Wow.
need to
Go
you
see
really
somebody.
need to get. I am not, it's beyond me. And
Absolutely.
if I really want you to get better, I have to be able to, refer appropriately. So
Absolutely.
I thank you so much for what you do. So I want
Oh,
to get
thank
into it.
you.
You spoke a little bit about the ecosystem, right? What does
Hmm.
that look like? We have psychiatrists, I know there's psychologists, there's
Hmm.
counselors. How do you all work together to
Hmm.
create like mental health, I would say?
I love that question. And so the way I would kind of phrase it is we have what we call an interdisciplinary model. That doesn't always have to do with mental health professionals. There are other non-mental health professionals in there, but there are several pipelines or several ways that people can access mental health treatment, right? It's not just a psychiatrist. Psychiatrist is one piece of the pie. We're medical doctors. We are physicians, right?
Yes.
Not everybody needs to see a medical doctor. So we treat the sickest of the sick. We treat people that
Right.
have mental health disorders, clinical disorders that require some type of intervention or more, right? And so we also well versed and able to do like therapeutic services and things that may not require
Okay.
medication management. But there are other specialists that actually are well versed in that because that is the robust part of their training and clinical expertise. And so, as a physician, I have patients that come in for mental health issues, but may also have other medical issues. And it's my job as a doctor to be able to delineate between the two and sometimes point out if some of your medical issues are causing the mental health issues or some of your mental health issues are causing the medical issues, the physical
Mm,
issues, because they actually go back and forth,
yeah.
right? You will not be, I mean, you will be surprised when you hear how many patients have maybe things going on with other organ systems, their
Yeah.
thyroid, right? Their brains, their
Hmm.
heart, their GI systems. And, it's like every time I get very anxious, I have diarrhea. Like those
Right.
things are
Right.
interrelated, right? So my job as a physician is to be able to kind of tag in what
Mm.
things are going on also in the physical realm and also in the
Mhm.
mental health realm. So that's what separates us from other clinicians. Now nurse practitioners
Okay.
and PAs can do some of that as well.
Mm.
But then the non-prescribing
Hmm.
team people in the ecosystem, so that do like the therapy work, they're not able to really diagnose and treat. Some of them can
Okay.
diagnose, but then they would have to refer for actual treatment interventions. And so we would
Okay.
have psychologists there. Psychologists can treat with therapy, but not medication management and other medical interventions. And those are like PhDs or clinical psychologists or PsyDs. They're the ones that can diagnose mental health issues. They can do therapy. They can do diagnostic
Mm.
assessments and formal testing for some clinical disorders like ADHD or autism or disabilities,
Right.
developmental disabilities, and then they would give recommendations on what to do next. And then we have like social workers and licensed professional counselors and licensed family therapists. Like they can do some counseling
LMFTs.
intervention. Correct,
Mm-hmm.
LMFTs. Some of those people and LCSWs, LMSWs, those are social workers. So social workers and therapists and counselors are in that net where they can do
Okay.
therapeutic services because they come with the lens of looking at what's going on in people's environment, right? In relationships and things like that, and how that's affecting mental health, and can give therapy that is targeting maybe some of those issues, right? And then if they need to elevate or escalate it for something that's a little bit more acute, dealing with like medical issues and coming from like a neurodevelopmental standpoint, you would refer to a physician.
Okay, that makes sense. I didn't know. Well, I guess putting it together it makes sense. The medical and the mental. It's like for some people, when they get anxious, their body, their physical body starts doing things. But it takes a
Correct.
while for some people to link it together. Naija
Correct.
Lebanese, she is a psychiatrist. That is her specialty. So he came in late for the intro. So she's a
Hi.
psychiatrist. So we're going to talk a little bit about that. So I
Yeah.
want to talk about something that I'm new to.
Mm-hmm.
I'm new to, and the I'm trying to understand the not severity of it, but the different levels of it, and that is anxiety.
Mm.
Recently, I think since COVID, let me say that, right? Since COVID, I think I've heard the word anxiety so much more than I've heard the word anxiety in my entire life. I mean, I'm young. I haven't been alive that old, but I'm a young thing. But I
Mm-hmm.
have not, like, now it's almost like everyone has anxiety. Oh, that's anxiety,
Mm-hmm.
anxiety, anxiety. And so at
Mm-hmm.
one point I was like, do I have anxiety? Because I felt left out because everybody has
Yes.
anxiety. So
Yes.
it's
Yes.
almost like, can you break it down? Do we all have anxiety? Is this real
So
anxiety? What is it?
that's a great question, Dr. T. So everyone feels anxious at some point or another. Anxiety is an emotion, right? That can get really severe and out of hand if we don't manage it
Mm,
well, just like anger, just like sadness, right? So we all feel anxious at one point. Not everybody has an anxiety disorder. There's a difference,
mm,
right? So the pathology there is when we're talking about a clinical syndrome. And there's different types of anxiety disorders, right? And criteria that have to be met to meet that. But what comes down to all of those disorders, there has to be a big change in your level of functionality, right? So
okay.
you are experiencing these anxiety symptoms that are now getting in, and you're not able to keep up with your daily habits or daily routines, right? And that is a problem. So a lot of times people do miss the two and confuse
Right.
the two. And, I want to speak to the anxiety that you're talking about, where everyone's like, oh my gosh, I'm feeling on edge. The community just feels like there's a lot going on. Most
Right.
of those people probably don't meet criteria for a clinical disorder or a psychiatric illness that's an anxiety disorder, but I think a lot of them are probably feeling what we call high functioning anxiety. And some of my clinical interests in my practice, I do work a lot with professionals and high achieving people, and that most people today are hustlers, and they're um, hanging on multiple jobs and roles, and their parents, their friends, their coworkers, they have one, two, three, four jobs and titles. So people
Mhm.
are doing a lot, right? And so I do think that has increased a lot of juggling different responsibilities and balls and things that they have to do. And I think what's causing high function anxiety and anxiety of that is where everything looks really good on the outside, right?
Right,
Most people are actually functional, meaning they're still keeping up with their jobs. They're still
right,
showing up to work, showing up to
right,
school. They're still
right.
maintaining relationships. They're showing up to the events. You're not
Mhm.
noticing any issues in their relationships, but inside, internally, they are struggling, and I think that's what they're feeling. This angst, right? So a lot of ruminations, overthinking, perfectionism.
Mm.
Feeling burned out, a fear of failure. So that is happening a lot more, and I think people are recognizing a lot more of this. It's really hard for me to relax. Like I can't
Right,
rest. There's a
right,
lot going on internally. So that's high functioning anxiety. That's different from a clinical anxiety disorder that we want to, treat with medications, all that right away, where the
mm,
functionality is completely impaired. And you can tell, everyone can tell something's not right with them. They're not going to work. They're not doing well, keeping up with their relationships, things like that. But high
right.
functioning, for a while, they're able to keep it together. They're able to keep it together.
Well, maybe maybe I got a little high functioning. I mean, as anyone that knows me or anyone that's that knows Dr. T, I'm high functioning something. Hi,
Hmm.
Anchor and Joy. I am
Hmm.
high functioning something. We'll get
Yes.
to that because I am doing 1,000 things, right?
Yes.
And I
Right.
am, but I don't feel like I'm anxious. I don't feel
Right.
like I have anxiety. Now, I see anxiety in other people.
Right.
Like, I'll give an example. I don't want to use the word procrastinator.
Hmm.
I work best under pressure. Let me say that. And I truly
Okay.
do. If you give
Okay.
me a deadline, just give me the deadline and tell me what needs to be done by the
Hmm.
deadline.
Hmm.
When I get it done, do not, I
Yeah.
can wait till a day before,
Yeah.
but let me tell you, it's going to come out and it's going to come out like
Very good.
now, I have people I'm surrounded by, loved ones, that they are like, how have you not done this? I'll give an example. My daughter's birthday. I mean, yeah, her birthday, her school party pack. Obviously, I know when my daughter's birthday is.
Yeah.
Obviously, I could have planned it earlier, but there's
Yeah.
something about working under pressure that I love and I
Right.
execute it so well. And
Right.
so, 2 days before, my loved one, my lovely husband is like, all right, is this an all night? I'm like, no, it's gonna
Just
get
chill.
done.
Chill out. I
But
got
I can see him like, what do
right.
you mean? Like, you got to do this. You still got to go to the store because I'm still going to the store. I'm
Right.
still ordering on Amazon, clicking that overnight, seven.
Yeah.
I'm
Yeah.
doing all those things. But by the time he woke up, everything was done. Like,
Wow.
perfect. And he's just,
Yeah.
and my friends say, they're like, how do you, like, they get anxiety watching me do
Yeah.
it.
So
But
you
I
may not
feel
have
it.
high functioning anxiety from what you're telling me. If you internally are actually doing okay, I think you're just a high functioning person who's juggling a lot, and you may be at risk for burnout, right? Because
Yeah.
maybe a crisis or two may
Yes.
happen and you're not able to juggle as much the way because you're
Yes.
just doing very high level things. But if
Yeah.
you've been able to manage it well and internally you're not crashing and burning, then you're fine. You're just like kudos to you. The only thing I would tell you is just pace yourself and watch out and make sure that you're not doing too much all the time because sometimes that could be a slow crash and burn that you don't realize until you hit the wall and then
Yeah.
you're like, oh my gosh, I didn't know. But for high functioning anxiety people, they are feeling it. It's not that they don't
Mm.
know, they are feeling it internally. Outwardly everything is looking calm and collected. They're actually keeping up with all their deadlines and things like that, but internally they are constantly overthinking. Did I do it right? Did I not do it right? Oh my gosh.
Mm.
They're
They're
not
over
sleeping well,
analyzing everything.
over analyzing everything. They are
Okay.
perfectionists. They have a hard time saying no, and they're people
Mm.
pleasers. And so
Okay.
that is a thing that yes, it's happening and it's problematic. They can tell something's not right, if that makes sense.
Right. Right.
So yeah, so the high function, so that that's where the ones come like, I feel anxious. Oh my gosh, I
Yeah.
don't.
Yeah. And I'm like, I feel nothing. Now
Yeah.
then, how do someone comes to you and they're like, and you notice that they are high functioning anxiety, right? And we're going to go from high to low, you guys.
Okay.
We're going to talk about anxiety and then we're going to literally dropped to depression because
Depression,
I want to spend a good amount of time on depression and things like that.
of
Um,
course.
but it's almost like, how do married people, if one is high functioning anxiety and the other person is like, it is, it
It
is
is
what it
what it
is.
is.
Like, how do you marry the two? How do you
Yeah.
advise or treat that, as a psychiatrist?
That can definitely cause issues in a dynamic. You can only imagine if someone is very high strung, right, and someone is very laid back. Sometimes it can balance out, but oftentimes the person who's strung, high strung, is they're high achievers. They have
Yeah.
outputs. They're going off of deadlines and things that need to be
Yeah.
done, and they might feel like their partner is just dragging along and not taking things seriously. And what are you doing
Mm,
here? We got, so I can see a lot of conflict coming from that, from a lack of understanding,
right.
and just not feeling like you're on the same page about a lot
Yeah.
of things. High functioning anxiety is very treatable. It is
Okay.
very treatable. I think the first step is for people to just be aware that it's there and understand that about
Mm,
themselves. And then the second thing I would say is, honestly, if it's causing issues, like you just pointed out, it's causing issues in your relationship, it's causing issues in your work life, it's causing issues even in your life, to where you're not able to just go to sleep at night and feel at peace because your mind is still racing. You're ruminating and you're anxious about if you finish this deadline, or did I please this person, or should I, did I complete this
mm,
perfectly? I may have to redo it again. I do think it might be worthwhile to get in with a professional. First
okay.
step, therapy. We're not going to go all the way to medicine. That's last resort. Going in to see a therapist, and any of those clinicians we talked about would suffice to talk about ways that you can kind of change perspective on
Manage.
how you're
Okay.
living your life and manage it, right? So a lot of it
Hmm.
does have to probably do with the way you think. Why is it that you are a people pleaser?
Yeah.
Why do things have to be so perfect? Why do you have a lot of shame if things aren't
Mm,
executed at this level? Yes, you messed up a couple times. Why is it hard to give grace to yourself? And you will find out a lot of people are dealing with some internal issues
mm,
that probably have been there for a long time. So
right.
maybe self-esteem, body image issues, being shamed a lot when they were children or kids, something to do with family member, family relationships that they haven't worked through. And so
Yeah.
there will be some unveiling that happens there, and they can get some healing done there, and that will actually help them in their present life.
That's awesome. And I think even this conversation is helping me because I have a whole lot of anxiety friends. I thought, I don't know why they're friends with me, because I just give them anxiety all the time. But it allows me to, I guess, understand them better now, right? It allows me to say, okay, them having this anxiety is probably because they care for me and they're overanalyzing and they want it to be great for me, right? Whereas I'm over here just being nonchalant about it. And I'm
Right.
like, I don't know why you guys have, I'm throwing it back in their face,
Right.
and it's
Right.
definitely not helping, right?
Yeah, because it's
So,
nothing they can help. They can't control it, right? If
okay.
they would not feel that way. And that's why I tell a lot of people that have high functioning anxiety and
Mm,
depression, it's not like they wake up like, oh, I have to be on edge. That's the really hard part, is they can't control it, right?
right.
They have to learn tools to learn how to manage it, and that's how they'll get better over time. But
Right.
they can't control it. Like they don't want to feel that way. It doesn't feel good to always feel on edge and feel like, I'm missing something. I'm not, quite 100% where I should be. And like you said, I can understand why them watching you do what you do and how you do it may be causing them a lot of angst because they are perfectionists, and maybe to
Yeah.
them they don't have the way to manage it like you do, where it's like, listen, I will have this ready, to go by tomorrow. Everything will look good. They might have wanted more time to prepare, or
Right.
a lengthier, their own like rigid way of doing things that would have brought the same outcome, and they are not able to be flexible to understand
Right.
how you do
Right.
things, and so it's causing a lot of angst for them.
Right. No,
Yeah.
I think it's really eye opening, at least for me. And you
Mhm.
guys, as you know, like whatever I can share, I share too, because it's this the health hub is not just for everyone, it's also for me included,
Yes.
right?
Yes.
Because I'm not
Yes.
perfect, I'm learning, I'm also trying to
Mhm.
get resources. So
Yes.
thank you for explaining that. Now you did say there are tools and things and you don't just jump to medication. So I was going to say, because I was on Instagram the other day, and
Mhm.
someone said they had a fear of flying or anxiety. It wasn't fear, it was
Mhm.
anxiety. And so she loves to travel. and she
Mm-hmm.
loves to, like, that's her safe space, but the path to get there gives her a lot of anxiety.
Mm-hmm.
And she's an NP actually, and she spoke about, I have to take medication, and
Mm,
that just kind of soothes. So I want to talk a little bit about, what does medication do to people, right? Is it to
yeah.
balance their hormones? Is it, what is
Yeah.
that medication doing? Is it rewiring their brains, or how does that medication
Yeah.
work, if that makes
For
sense?
for the anxiety disorder, that's a great question. So there are some patients who like, so that anxiety that you talked about, like that's clinical anxiety, right? It's getting in their
Mm,
way of being able to perform a task in their life, right? So I
right.
can't get on the plane. I'm so anxious and for a lot of those patients, it's not just like, oh, I feel on edge. They might have panic attacks. They might
Mm,
have breathing issues. They might feel very on edge, muscle tension, headaches, things like that. It's just in anticipation of getting on that flight. It can get pretty severe for a lot of people who are dealing with things like that. So that's where medications can be a helpful tool to
right.
help, because that when you start having physiologic symptoms, physical symptoms in
Mm,
response to the anxiety, medicines can actually go to your brain and kind of downturn some of those receptors responsible for causing that fight or flight response, that fear
right.
that they're having. And so for some of these clinical conditions, right, it's not just an emotional response that they're having. A lot of times they're having biological, like neurobiological responses from their brain. Their brain are actually releasing chemicals that are telling them to be afraid, that are telling them to feel panicked. And so what the medicines will do is go to the brain and try to shut down those receptors so you don't feel the intensity of that. And that can be life changing for a lot of people. It can be extremely life changing. Yes, because imagine, sitting on a plane, afraid that the plane's going to crash, or I can't,
Yeah.
feel like this plane's going to take off. And you are literally, I don't know if you've had a fight or flight response before where you feel like doom, like I'm going to
Yeah.
die. It
Yeah.
is really, really, really just, it's painful. It's terrible. And
Right.
so when you have this medicine to just help kind of calm that down, it is a significant improvement in your quality of life. And
Mm,
so for things like that, the medicines will help short term, but then therapy is
mm,
also needed for long term, right? To identify what the cues are that are making that anxiety worse, and how can you deal with that with other coping skills. And
right.
so for a lot of people with anxiety, not everyone is a candidate for medicines. There are other tools like breathing techniques that have been proven, long proven, to help de-escalate feeling really intense anxiety. Talk therapy, supportive therapy, also very, very helpful. Mindfulness techniques that you can do to go back to the brain and help it calm down without having to take a medicine to help it calm down.
Okay. I mean, I think, well, welcoming everyone. If you guys are just coming in both on IG and TT, we are speaking with Dr. Gloria Odum. She's a psychiatrist. Right
Mhm.
now, we're speaking about high functioning anxiety. We're gonna switch gears in a little bit, but we're wrapping this up, and we're talking about tools and the resources and how to manage it. And the difference between anxiety disorder and high functioning anxiety. I did not know that. I thought everything was wrapped in one. So I'm definitely learning a lot. So thank you all for being here. Please share it out, share out the lives on both platforms. On my TikTok, people, please tap. Let's get to 10K. Drop your heart
Woohoo!
me. Touch my was it my gift gallery if you can, all of that. Thank you guys so much. For the people moderating, thank you so much. IG. All right, so let's kind of wrap up our anxiety conversation. I'm not against medication. My fear, and I think you touched on it a little bit, is if they are on medication, is it short term? I know you said a little bit like it's short term for them to get the tools, but I'm almost like, let's talk about GLP-1s. You're like, what does GLP-1s have to do with this? It's almost like, it's a appetite suppressor, right?
Mhm.
Suppresses your appetite. And from what I've read and from what I've heard and experienced, it's like once you stop taking it, it's
Mhm.
like you gain that weight
Mhm.
much faster.
Mhm.
So
Mhm. Mhm.
my question is, for those that are on the anxiety medication, they're
Mhm.
kind of leveled, they feel good, they're good, and then we start winning them off, or they
Mhm.
stop taking it. Does that level of anxiety come back worse, or what happens?
That's a great question. So I would not recommend people to stop their medication regimens without the supervision of a competent, specialist, a doctor that can treat that. I say that because these medicines are not benign. They come with risk, taking them. And so if you stop them abruptly, there can be issues. And I've seen that happen a lot of times with patients. So to answer your question, yes, if you stop medicines abruptly, you can have a withdrawal syndrome on those medicines, and it can actually rebound your symptoms to be worse off. It doesn't mean that you are having underlying issues. I mean, your underlying anxiety problem has come back and will stay forever, but it can feel so intense that, like, oh gosh, I have to get back into this medicine and stay on it because you were having some withdrawal. Um, there are a small subset of people who probably will need medicines for life, and that's because they
Yeah.
have a clinical condition, because their brain receptors are just not as robust at dealing with, these disorders without medicines to help stabilize them, if that makes sense. So
Right.
there are some people who need medicines. There are also a lot of people who are on medicines that probably don't need to be on the medicines,
Mm.
right? And I do think that if you are working with a clinician that is staying on top of that, there should be some attempts, if you've been stable for a long time, to try to get you off
Right.
this medicine slowly but surely and monitor you to make sure that you're doing okay. I do think that there's a burden, especially in psychiatry, with overprescribing medicines.
Mm.
And it's sad to see, because medicines don't always need to be the first line
Right.
approach to everything. I think that there are some conditions that are underprescribed because
Mm.
people are not getting, the real people who need the help are not getting the care they need. And there's
Right.
also overprescription, meaning the people who probably don't need those medicines are hopping on
Underneath.
medicines first
Yeah.
line. And what that does is, I think it gets in the way of being able to build some resilience by learning some true coping skills that will help you long term. And so, in my clinical work, my job is to really help patients live their best life with or without medicines. If they do
Mm.
need medicines, take away the stigma and shame from having to
Right.
be on medicines. Those medicines are tools that will help you improve your quality of life. But there are some people who truly don't need that long
Right.
term. And my goal is to help empower them to not need that long term, and help them also live their best lives without saying, hey, you need this, go from there. So you have to be able to tell the difference. And I think that's the skill that I was talking about earlier.
Right.
Unfortunately, there are people out there getting on medicines left and right, and people are not helping them determine, I've been on this medicine for 10 years, for 20 years, for 30 years, and they didn't need it.
Right.
There
Right.
are some who do, but not everyone.
Right. Good. I mean, good touch because let me say my little two piece. I'm all about an advocate. If you aren't sure, get a second opinion. I like second opinions. I like third opinions, not
Mhm.
necessarily so that you can hear what you want to hear, but just so that you feel comfortable, so that if you're on that medication, that's what you're on, We do have a question on TikTok. And she said, oh, thank you for pinning.
Aw.
Please, can anxiety cause one to be unable to sleep?
Absolutely. Yes. That
Yes.
is actually one of the core clinical criteria for anxiety disorders is
Mm.
insomnia. Yes. And they're not able to sleep because their minds are racing. There's so much on their mind that they can't shut it off to sleep.
Mm.
So for those patients, typically they're one of the ones, depending on how bad it is, they may benefit from a short treatment of medication, because insomnia is so bad. I'm sure you understand, when you haven't gotten a good night's rest,
Yeah.
just one night, I mean, that can be pretty bad. But imagine not being able to sleep night after night after
Night
night,
after
because you
night.
just can't shut down your brain. Your brain is just going
Mm.
haywire. So a lot, and let me tell you, for a lot of high functioning people who are juggling so much, when there's
Yeah.
so much to do and think about, it is hard to shut down. Our brains were not meant to carry so much information, and now we are, right? And so it's really hard to really bring that down so you can feel zen and go to sleep. And so that is actually one of the core symptoms of anxiety. So I screen
Oh.
for that with every patient. How's your sleep? Because a lot of times they won't know that, oh, this is linked into my anxiety, and I have to make that connection for them.
So if they have, let me see, Jake, let me see, I think it was JK Lifestyle in Quotes. Does that answer your question? And I think that's huge to talk about because sleep is so important. Your body's then constantly. This is coming from somebody who doesn't sleep. By the way.
Team no sleep,
Yeah,
Dr.
let me
T. Come
preach
on.
about something I don't do well. No, I do. I there are a couple of nights I pick in a week. Hi, I am Jay. Welcome in. There are a couple of nights I pick in a week that I
Yeah.
sleep. I have like my Tuesday, Thursday sleep now.
Oh my gosh. So I tell you again, my dear, you are one of those people where, watch out. Like you
Yes,
can do that, but it's probably not long-term sustainable.
it's
Get your
not.
sleep.
It's
Um,
not.
yeah,
Next
as
week
a
we're speaking with an MD that's going to talk about like burnout, and I know that's going to be about me. Like she's going to talk about burnout. She's going to talk about being an ADHD mom. I feel like I am
yes.
now diagnosing myself. I think I have. I At this point I'm like, my mom is like, God forbid, don't put that on yourself, and I'm like,
Uh-huh.
I'm all over the place. I probably got a good ADHD, you know. So
Yes, yes. I would be so, I would probably try to tune in here so I can hear a little bit about that.
yes,
There's a huge, and that's a whole different topic. We don't have to get into details about that,
yeah,
but that's another condition that I treat. And there's
mhm,
a huge emergence of people who are experiencing cognitive symptoms
yeah,
in today's age. And, they're hearing a lot about ADHD as a
hmm,
diagnosis, and some of them
yes,
have been untreated for a long time, right? And they were able
right,
to manage it for a long time. But now, because they're juggling so many balls, I think some of the
right,
deficits are now, they can see it more because, when I was only doing 5 things, I was able to manage just fine. I
yeah,
was able to learn coping skills to mask it. But now
right,
I'm doing 20 things and my ability to mask it is probably not as good. And so here I am now in my
yeah,
30s and 40s, and
yeah.
things are falling apart. And then also perimenopause is another thing. When you start having hormonal
Mhm.
changes in your body, that can actually
Okay.
cause cognitive symptoms that look like ADHD, very, very similar. So
Oh,
yeah,
wow.
that's going
So
to be a really good topic.
perimenopause can be linked to ADHD.
It can cause cognitive symptoms that look just like ADHD.
Oh, oh,
Yes.
wow.
Yes, yes, yes. So it's not that they have clinical ADHD, but they have
Right.
ADHD like symptoms, and you treat them sometimes the same way. But you have to bring it to the fact that it's because of the hormonal things
Hormonal
that's it's caused.
change.
Correct. So stay tuned, girl. In our 40s, it's coming.
Look,
A lot of us are going to
hormones
be like,
are like, hor- hormones are just, that's another
yes,
world. But yes,
yes.
any questions about anxiety? I want to kind of wrap up anxiety before we talk about depression. And I
Mhm.
wanted to start with a high, right? And we'll come back and end with a high because no one wants to end, with
And
depression.
before we move on to depression,
Yes.
while people are bringing questions, I just wanted to bring up that, for a lot of the people who are having, people pleasing issues, perfectionist and issues, because that's some of the core is what's causing the high functioning
Mm.
anxiety. It's going to be really important to learn boundaries, right? Learning how to
Mm.
say no with your chest and just saying, I've reached my limit of what I can manage, and that's it.
Right.
I'm not going to do
Hmm.
more, because that helps a lot with their quality of life down the line. This is how you can help that internal angst get better, right? So yes, working on self-care and taking care of yourself, meaning protecting your time, getting adequate sleep and nutrition and things like that. But then also in just all the things that you juggle, taking a good look at that and saying, how do I prioritize my time to where, I'm not just yes ma'am, yes sir to
Right.
everything.
Right.
Because that's kind of what's happening is it's capacity overload. So
So do you know how to fix that? Look, let me tell you how to fix that. You marry a high functioning spouse who's gonna tell everybody, no, my husband or my wife can't do that. Who's gonna speak for you? Because those over analyzers and the perfectionists and the people pleasers, they don't want to say anything. So
right.
it's like you need to marry the opposites.
Yes.
No, go back and put the
Yes.
ketchup on the
Yes.
fries because
Yes.
that's how my husband likes it.
Absolutely. Absolutely. It makes a
So
huge difference when you have people in your life that can go back for you. But, eventually the goal, in self-sustaining is for you to learn how to do that for self, right?
right,
Because we don't want to build a codependency. It's great to have a partner who can do that for you, but being able to learn to do that for yourself is the
yourself.
goal.
Yeah.
It's the goal. Yes.
Absolutely. We have one more question here. How to get rid of anxiety? Like, is it something we can get rid of totally? Or, like, yeah, how do you get rid of it?
Um, I don't know that you can get rid of it totally. I think you
Mm,
can manage it significantly to where you're not feeling the impact of it. Like I
yeah,
mentioned, anxiety is a feeling that all of us feel. You're never,
yeah.
never going to be able to. And that's why I kid you not, I come to people being like, I don't ever want to feel anxious ever again in life. And I tell
Mm,
them, I will never be able to do that for you. We are all, anxiety is a healthy emotion sometimes.
true.
Sometimes you need
True.
to feel fear.
Yeah.
You need to
Yeah.
feel afraid of something, right?
Yeah.
um,
Absolutely.
fear higher power, fear something in life. You need to fear.
Yeah.
But the problem again is when it's getting in the way of your functionality. Now that
Right.
we should be able to eliminate or at least almost eliminate. Absolutely. Will I be able to tell you that you will never feel anxious? No, because
Mm.
it happens. Just like I could never tell you that you're never going to feel angry or sad.
Mm.
Does
It's a
that make
moment. It's
sense?
another kind of emotion
It's
that
another
we're meant to
emotion,
have.
but we need to learn how to put it in check, which we can.
I like
Absolutely.
that. First gift, Elizabeth. Thank you. I like that. I like that. Thank you, Dr. Gloria. I'm telling you, I'm learning a lot. I promise you. I think my outlook on things will be a little bit different in how I even I guess relate with some of my my anxiety like friends
Anxious
that
friend.
I
Yes.
know wish the best for me and just, I
Yes.
make their life worse. So I want to switch gears a little bit. I want to
Yes.
switch gears to depression.
Mm.
I have been seeing either directly or through my circle
Mhm.
about people who are like either unalive, I can't say the DEAD word on TikTok, so I have to say unalive, and which I think is
Okay.
even better. It's not so strong. People that are unaliving themselves, people that are outside, they look great, they're laughing, they're the talk of the party. They're there, but then inside, they're really, really very good. Jacob, we're going to talk about that. Inside, they're really depressed, and
Mhm.
then you hear of things that happen, and you're like, wait, what? Like
Yeah.
him? Like
Yeah.
how? Like, you know what I mean? So I want to
Yeah.
talk about, and I think JK Lifestyle has helped me transition into this. Is can anxiety lead to depression?
It can. It can. And so that's actually, I'm glad that we're able to talk about depression because that's the one that can be really tricky if we miss it and can
Yeah.
have some devastating outcomes, more so than the anxiety, the high functioning anxiety. So, we think of classic depression, right, as people who are sad all the time.
Mm-hmm.
They're kind of keeping to themselves. They've isolated from others. They're not able to get out of bed. They're tired.
Mm-hmm.
They don't really feel joy. They're having a lot of guilt and shame, sometimes hopeless, and then sometimes having thoughts about not being here anymore, right?
Right.
And some of them might even attempt. High functioning depression is, they are feeling a lesser degree of all of those things I just said about, but they look great on the outside.
Yeah.
They have a nicely curated exterior to where they're still keeping up with their everyday life. They're still going to
Right.
work. They're still going to
Right.
school. They can still maintain relationships, but they
Mm.
don't feel real joy in their lives and they're sad internally. Those signs are more subtle. And I think that's where we talk about check on your strong friends.
Yeah.
This is where that
I have a
comes in.
shirt
Check
that
on
says that.
people
Right.
because those ones are a lot more subtle. You have to kind of dig to see what's really going
Right.
on inside because on the outside it looks good. And so, yes, with the anxiety, if you don't keep that under check, it can lead to depression. If you don't keep some of your other, like not sleeping, not taking care of yourself over time, that can lead to breakdown, which includes depression. And we don't want that to be a clinical thing to where we're having to, start on medication because that can happen.
Mm.
And of course, we can get you better soon if we know what's going on, get you intervention, go see a professional that can get you started on treatment. But the goal is to try to avoid that from happening in the
Right.
first place, right?
Right.
Yeah.
So I like that you broke it out into two types of depression because you're right. We're used to the sad, crying all the
Mhm.
time, not interested in what they want to do. It's so physically you can tell that they're depressed. So
Right.
it's easier to see those signs. But
Mhm.
those that aren't, right? Those that, show up to work and
Mhm.
they're showing up to their kids' baseball games and whatever the
Mhm.
case may be, but there's balance. How do you see those signs? Like, what are those signs? Because you said they're subtle,
They
but
are
like,
subtle.
how do we see them?
So sometimes you really have to poke and prod to get these people to admit what's going on. So that's one way, and they'll tell you if you listen well enough, you'll
Mm,
hear the warning signs of
mm,
things that are amiss. If that makes sense, right? They're
right.
not typically because when they go back home, sometimes they're not able to fake it anymore. So when you
Mm,
come into their home environment, you can see how they're really living, and sometimes that's one way you can tell. But other ways I can tell if you're like I said, it's subtle, but you will notice like that twinkle in her eye is gone.
Right.
She's here, but
Mhm.
I don't. She doesn't quite. She doesn't quite look. And you know what I'm talking about, right?
Right.
Like
Right.
I just you don't feel as joyful as you were before, or something, some quirk or something that is known for that friend. You've noticed is a little different now, and that's something to say.
Right.
Hey, let me check up on this person, investigate further. Like, what am I missing? But a lot of times, people are really good at hiding it so much that you just have no
Hmm.
clue until you hear about a bad outcome. And then
Right.
it's like, oh my gosh, what happened? And that's why for those, it's really, really important that, yes, you want your loved ones to be the ones to kind of check in, but you want to be able to see those signs for yourself so you can get
Right.
help before it gets worse. So the goal is to try to reduce the shame and stigma from being able to identify, I think I low key, I might be high functioning depressed. I need to get help
Yeah. Yeah.
because some of them hide it so well. The other
Right.
thing to think about is substance use. A lot of times
Mm.
they cope by self medicating. And so, I mean, I have seen a friend who was doing just fine down, 6 shots, in
Mm.
one outing, right? And that's typically not like them, but they're drowning in something,
Right. And
right? And it's like, that's
something.
not normal. I'm going to follow up with so and so and say, hey, what's really going on? And most times, when people actually take time out to spend time with you and check
Yeah.
in, they'll
Yeah.
they'll open up.
Yes.
Most people just don't want to open up because they don't want to feel like they're a burden.
Mm.
That's actually the sad
Mm.
part. They don't want to feel like they're a burden. And most people that I know who have not taken themselves out, I don't know if on my end I can't say the word because you're saying I can't say it on TikTok, but you know
Right.
what I'm talking about.
Yeah. Yeah.
When they're not alive anymore, it's because they didn't want to be a burden, and they felt
Mm.
that doing that was a way to not be a burden to anyone. And that's how sad your mind gets, that it plays tricks on you to convince you that that's what's going on.
Right.
And so when people take time to actually spend time with your loved one and check in with them,
Yeah.
it goes a long way.
So I'm glad you said that because one thing that I miss, I think growing up, and even not even, I think growing up we did it, but even when I was younger, like in my 20s and like the early part of my 30s, we used to go hang out at people's homes.
Mhm.
Right. I remember my parents growing up, they were like, oh, we're going to go see this auntie. We're going to go see this uncle. And we'll be
Mhm.
at the house all day. Right. We'll
Yeah.
eat breakfast. We'll do this. We'll do like, it was just nice. But then
Mhm.
I feel like now we're all like, me included, right? Like I'm
Yeah.
doing up and down and I'm doing 5 million things. Right. And we
Yeah.
don't get to spend time with each other. But like someone like me, I noticed that you're no longer posting on IG. Like, let's say you're a poster. You're no longer posting on
Mhm.
IG or you're not answering my calls because I never call. I only text. And then I call you and you
Right.
don't pick up and you know that I
Yeah.
never call.
Right.
I'm popping up at your house.
That's
Like
right.
I'm that person where I'm knocking at your door. I'm
Yeah.
covering the peephole
Yeah.
because I don't want you to not because I want you to think I'm Amazon.
Yeah.
And then I want you to think, open the
Yeah.
door.
Yeah.
But I think we're missing that a little bit. So it's hard to see those signs
It is hard. And
because
that's
we're
why, yeah,
moving.
we're moving so much. And Dr. T, that's the part that makes me worry sometimes, because that's where we are as a society, is we're not
Mm.
spending enough time in community. We're not really spending time like just checking in on each other, spending time
Right.
with each other. We are distracted
Yeah.
by other things. That is increasing the risk of people feeling isolated, feeling alone, feeling
Right.
down, And
Right.
so I think that can be it. The only way we can fix that is just for people to be mindful of their time and being and
Right.
have some insight about that, and just try to make a little time to spend with your loved ones. It does make a huge difference. It does. Yeah, we're all distracted by
We
just
are.
life, things, responsibilities, right?
Right.
Chasing money, spending. I mean, like it's all good to have that, our works, our jobs, things that bring us
Right.
meaning, but we're so isolated now that it's causing cracks in
Right.
in the foundation.
So I mean, what do you do? One
Mhm.
of my sit downs that I've had, if you guys didn't come in, if you came in later in this, I talked about how life has been lifing for some people in my community the last couple of
Mhm.
weeks. And I've had to
Mhm.
sit down and check on a good amount of my, hold on. TikTok is telling me something. There we go. It always makes me do a puzzle. I'm moving my
Okay.
hands. I talk with my hands, but yet it's telling me I'm not moving. um, but maybe lose my train of thought. But yes, life has been life into some of my community, and so I've been sitting down and spending time with
Hmm.
a lot of them and just listening. And I remember one of the conversations that I had was actually with a male, and
Hmm.
he was like, "I'm depressed, and I've been depressed
Hmm.
for a couple of years now." Right. And I did not expect him to say that to me at all. I just expected him to say, hold on one second. I just expected him to say, he is, life is happening, the typical that we typically say.
Hmm. Hmm.
Um, but I was very taken aback that he opened up and was like, I'm depressed. And, I know he's seen a counselor. And of course, I'm always like, are you seeing a psychiatrist? Because to me, I always go to a psychiatrist. I don't know why. I don't have anything against LPCs, LCSWs, NMFTs. I think they're all amazing. But at
Yeah.
that level, I'm almost like, could this be deeper than what it is? But
Right.
then I don't know how else to support.
Right.
Like, what else do I do? Like, yes, I can recommend go see a professional,
Right.
but what can I also do as a friend, as a
Hmm.
loved one, when
Hmm.
someone tells you that? Because I took that on. I was
Yeah.
just like, oh my gosh, he told me this. I can't ghost them. Like, what
No,
what do
no.
I do? Do I
Ghosting them, there's so much you can do as a loved one to someone who's depressed, right? One, I think the best thing is getting them help, right? So like calling
yeah,
911, which is like, let's get you help. So help would be, let's try to figure out if we can get you in with your primary doctor, a psychiatrist, a mental health provider, someone that can get you treatment right away, because that's you want to escalate kind of the
right,
care and support that they need. But even you as a layperson to them can do a
right.
lot, whether it's lending an ear. I'm going to check up on you
Mm,
every day, okay? And we're just going to talk
mm,
for 30 minutes. I'm just going to be quiet and I just want to hear what's on your mind, right?
right.
Let me come over and just sit with you. We're going to share a meal together. I'm bringing dinner. You can't say no. We're going to watch our favorite show together, okay? And it doesn't necessarily have to, because sometimes when they're depressed, they don't want to sit there and ruminate and talk about all the things.
Mm,
They're like, I don't want to, I'm already but just to sit there and say, hey, I'm here with you. I'm going to hold your hand. I may not understand everything that's going on, but I'm here and we're just going to spend some time together. And I just want you to
right.
know you're not alone.
Mm,
That makes a big difference. Bringing
mm,
in other loved ones for support. There are a lot of times when they've isolated themselves so much, their
yeah.
family doesn't know what's going on, their friends don't know what's going on, their job doesn't know what's going on. So advocating for them to say, hey, do you need time off work? Maybe when we go see this doctor, we can talk about maybe you taking a week or two of FMLA or just something so you can get, catch up on your sleep and get the rest you need to feel better. Do you need, as a doctor, I see patients and I do therapeutic timeouts. I'm like, okay,
Yeah.
you are doing too much and I don't think
Yeah.
it's helping your brain recover. We need to slow things down and try to get back on track. But as a friend, those are all things that you can
Mm,
do. I'm just gonna, okay, I don't have time to stay with you. I'm doing too much. I'm gonna drop off a meal and I'll
right.
follow up with you tomorrow on the phone and we'll talk and check in. And there are things you can do on a spiritual level. I
Mm,
believe in the power of prayer. You can do that for them as
absolutely.
well, right?
Absolutely. Prayer
Finance.
is yes. That is one thing.
Yes.
That was the only thing I could turn to when I heard it. I was just like,
Right.
of course, you know me. If you know me, I'm rebuking it. I rebuke the spirit of depression in you. And he's like,
Yes. Yes.
okay. But I was
Yes.
like, well, let's pray because I don't know what else to
Right.
do about
Right.
that.
So
Can you make it like can you not joke about the depression, but could you try? I'm a jokester, right? My goal in life is to make people laugh, like, and to
right.
just make you be just your authentic self. And
Yeah.
but yet I found myself kind of like, okay, this is serious. Like, get it
Mm,
together. Don't be your
yeah.
typical jovial self, because
Yeah.
I didn't know how to handle it, right?
Oh,
Especially coming from a man.
yeah, no, you can still be yourself. They would appreciate it, not feeling like I'm walking on eggshells around you.
Yeah,
They feel that energy. And,
right,
that doesn't feel so good where it's like, oh, now I'm this fragile, delicate thing. Geez, I'm a
right.
burden to you. Let me even isolate myself more. So continue to be yourself. They may
I
not
made him get
feel
up and make me a meal. So
that's,
I was like, I know we're talking, but I'm hungry. And he looked
yeah.
at me. I was like, I'm like, I came after work. I popped up. I'm hungry. And he got up and made a meal.
Well, if
Threw
he's
me away.
capable of doing that and it didn't take away from him,
Yeah.
I think that's just fine and dandy. But they may not feel the joy of the whatever joke it is that you made or all of that, but
Yeah.
just know that they're going to make an attempt to do so. It meant something to try to bring them in into something that could bring joy and laughter instead of not even trying at all, you know? So I think that's actually really important that you spent time with them, you made efforts to engage with them, you prayed for them. Those are all the things you should be doing as a friend. And then
Right.
of course referring them to get help.
I think there are a lot of people, so many different things that I'm learning causes depression. I don't know why I thought it was just certain things that could cause depression, right?
Mm,
And so I'm learning, people not feeling. I heard one, I think last week, I'm not able to be myself, and because they're not able to be themselves in their marriage, in their relationship, it caused depression, and then that spiraled into other things. So I'm also learning that, just like how it looks different for
mhm.
each person, which is why my shirt says my best looks different every day, you
Mm,
know I'm noticing that there's so many reasons and so many causes of it.
yeah, yeah.
um I do want to ask, at what point does a person get so depressed that they want to unalive themselves? Like, what takes that, I guess, that leap, that jump into, I'm depressed, I don't, but then to like get to that point of where you can have self-harm, because that's a
Yeah.
lot. Our
For
bodies are not made for that.
depression, yeah, for depression, the number one reason that they would do that is when they've lost hope.
Mm,
So when someone's hopeless, that's a really dangerous place to be.
mm,
It means they don't see the light at the end of the tunnel. And when that happens, we're in a very dangerous place. So, and by then their brain's pretty sick. Their brains convince them, that there are no solutions. Things are not going to get better. You're better off not being here. Everyone else will be better off without you. It's not going to get better, and so that's when they start trying to find ways to end their pain. And sometimes
right,
they're in so much emotional pain and turmoil that they just don't want to live anymore, you
right,
know? And that happens too. But a lot of times it's because they feel hopeless. So
right,
when I screen all of my patients with depression, that's actually a very critical question you have to ask is, do you feel hopeless and helpless? Because when that's there, then, we have some work to do
right.
in assessing your safety, assessing your willingness to live,
Mm.
and making sure that you feel supported there.
Absolutely. You guys, I think I got a restriction for saying something, so
Ah,
sorry. But they can have their restrictions. Because we're
it's
gonna
an
talk
important
about,
topic. Yeah. I
um
didn't know TikTok censored people like that.
oh, it's
Wow.
very sensitive.
Really?
It's
So there's
very,
things that you just can't mention because okay.
yeah, there are a lot
Good
of
to
things, there are a lot
know.
of words, but yet there are
Ah,
people doing things on here that I'm like,
I see.
we
Well,
can't even
kudos to
say.
us so far. We made it almost an hour and we've not been censored. So I'm like, okay, because it's some delicate stuff to talk about,
It
So
is. It is.
good
And I
job.
think that's
Yeah.
why I wanted to talk about it, because
Yeah.
no one really talks about it.
Yeah.
I want to talk a little bit, and I don't know if you specialize in this part, and you don't have, if you don't, it's okay.
Hmm.
But I do want to talk a little bit about postpartum depression,
Hmm.
what that looks like for some
Yeah.
people,
Yeah.
how to educate significant others with that,
Yeah.
right? Because I don't want to say depression is depression, but it's so wide. It's like, to me, it's almost like a spectrum too,
Yeah.
right? To
Yeah.
where not like it's managed the same, but awareness of that is really, really important,
It
because
is. It
you're
is.
hearing people talk about postpartum more. People are being more
Mm-hmm.
open. I'm
Mm-hmm.
seeing posts about women who, one was scared to have their second child because of what
Oh,
happened with the first, and
yeah.
so I want to talk about that kind of depression and how to
Yeah.
kind of come out of that, and what the significant other can do to support.
So
Hi, TikTok. I hope you guys
great,
can still
great.
hear me.
I hope, are you still live there?
Yeah, I am.
Okay, good. Very important topic. Glad you brought it up. Yes, I do specialize in that. That's actually one of my clinical interests is in women with perimenopausal disease, post sorry, disease, well, disease too, perimenopausal symptoms, and the post perimenopausal period, postpartum period, and then things having to do with menstrual disorders, so PMDD,
Mm.
things like that. Postpartum depression, anxiety, psychosis, postpartum mental health issues in general are a very, very, very important one to not
Mm.
miss out on. And that's one of the ones that I would probably say, if anything, get them to a psychiatrist or a medical provider right away. Because that postpartum period is a very sensitive time. It's a
Yeah.
very, very critical time. The hormones are just all over the place and it can be
Yeah.
really intense. That is a biological thing that's not going wrong.
Mm.
9 times out of 10, it's not just you feeling something, it's your brain that's not working
Mm.
properly because the hormones are just dysregulated and now your symptoms are really intense. And I say get them help because we have to try to get that fixed or treated sooner rather than later so
Okay.
mom can go back to being mom and still
Right.
bond with her baby. What really hurts me a lot of times is women with postpartum depression, anxiety, not having support to get the help they need
Right.
because they are so consumed with family life and
Yeah.
responsibilities and obligations, and they fall through the cracks because it's just like, well, just manage, we'll just do
Yeah.
this, and things get worse and worse and worse before it gets better. So a lot of times there is a spectrum. Not everyone that's feeling sad postpartum has postpartum depression. So I know there's a lot of education there to tell people what's the difference between regular postpartum blues, which is like it's your
Mm.
hormones are crashing. You are gonna have sad moments, that
Yes.
happen,
Yes.
and those can be managed and tolerated well. And postpartum depression, the clinical symptom is when things you just are not managing well,
Right.
and we are seeing a lot of incidents of that more now because a lot of moms don't have the support. Not everyone's moms can come
Yes.
stay with them for
Yes.
3 months or 2 months.
Yes.
They don't have support at home. Their husbands may not be supportive, right? Not everyone has a husband who's willing to wake up with you at the middle of the night and do feeds
Mm-hmm.
or hold the baby for a little bit so you can take a
Mm-hmm.
bath or help cook the meals for the other kids, right? And so your partner involvement or lack of can significantly contribute to that too. So I love when you said, like, how can we educate spouses and partners and loved ones about this? Because they are a huge part of the solution and a huge part of the problem. For a lot of women, I've had to call, to Jesus, the husband and the mom-in-law and whoever else. I'm like, this person is drowning,
Right.
and she will continue to drown if we don't put an intervention in place. Like she needs to, she needs help. What
Right.
can we do to help her sleep? And a lot of times it's because mom's not sleeping.
Mm.
Right. Mom's just not
Yeah.
getting any sleep. So it all boils down to that. The lack of sleep can cause so much dysfunction, especially when the hormones are already disbalanced and then you're not sleeping. That is a crash course for all kinds of disease kind of getting worse. So.
I love that you literally said what I was hoping you would say was the community and the support. I
Mhm.
remember when I had my daughter, I think my mom is still on here. She's gonna be like, "You talking about me? You need to clear it with me." I remember when I had my daughter, I'm number one, I'm blessed. I am super blessed. I don't take it for granted. I have a very good community, too good of a community, but I'm so blessed. And I remember my mom coming and staying with me when I had my daughter, and we were talking. And I don't remember if it was somebody that I knew that was battling with PTS, well, postpartum depression, or if we had seen something on TV. I would have to go back truly and remember what linked it. But I remember discussing it with my mom. And my mom was like, "What's that?" And I was like, "Oh, postpartum
Mm,
depression, And so she sat on it for like a week or so, didn't talk about it with me. Then
mm,
she called me one day. I think we were driving somewhere, and she said, when I had you all and my generation, we didn't even they didn't even have to get up to shower if she didn't
mm,
want to. All she had to do was feed the baby and hand the baby over. So
yeah,
she did get sleep. She
yeah,
did get support.
yeah,
She went back to say, okay, what is the difference between you having a baby and when I had you? Welcoming everyone, right? And she kind of connected it on her own that she had a whole community.
yeah,
And even though I had one, there are people that do not have that community. And
correct.
that's kind of what leads to it. And so we talk about, when we come from, like, I'm Nigerian, and in our culture, there's some things that your mother-in-law or your mom, the roles that they play to help you and things
Yeah.
like that.
Yeah.
But nowadays, when everyone being in America, everybody's working.
Right.
Grandmas are working, grandpas are
Correct.
working. They're,
Correct.
it's not like they can leave their lives and come and spend 3 months with you unless
Right.
they're really equipped to do so. So that support is huge.
Huge.
And you touched on
Huge.
it, even coming from your spouse or the person that
Mhm.
you've had that baby with, that goes a long way,
Does.
because then you're not doing the same, the whole
Yeah.
weight is not on yourself,
Oh yeah. Oh yeah.
right?
There's a lot of expectations that spouses still have of their wives, even though they haven't talked about that. But even though, the woman has had the baby, and they still expect them to have meals ready on time and the laundry done on time and the chores done on time, and not realizing that this woman's body's still healing, and she's just not going to be able to, she may be breastfeeding and trying to
Right.
bond with the baby and feed the baby. Like, so yeah, it's a big, big, big deal. And having to educate them on,
Right.
what changes to look for. Like, she's
Right.
not going to be herself. She may be more tired than usual. She's maybe more
Mhm.
sadder than usual. And you have to be there to emotionally support her too. Not just, physically support her in the home, but also emotionally support her.
Right.
So yes, that is actually a critical part of the recovery. It's not just medications. I do think a lot of women will need some level of medications that if their symptoms are severe. But I like to look at the environment there, because that we can make some critical changes there to help.
Absolutely. And I hope, I do these lives, and I, bring you subject matter experts so that you guys they can hear from the true expert's mouth, and not just
Mhm.
word of mouth, or somebody said, or they said. We
Right.
never know who they is, right?
Yeah.
But it's like, I hope this gets to people so that, one, everyone is educated,
Right.
and two, we can speak up.
Yeah.
I'm very big on life is life into everyone.
Right.
Everyone. Like, every single, it's just been hitting me, like, in
Hmm.
every areas, right? And so it's hard for somebody to check on you,
Yeah.
because life is happening to them, and
Hmm.
they're trying to, like, they're drowning. And
Hmm.
so it's like, if I'm drowning, I honestly don't even have the energy to now take on somebody else's problems. I don't want to check on you, right?
Right.
So my thing is having people to speak up.
Yeah.
I am a big of, if I'm tired, I'm tired. Like,
Yeah.
I like to verbalize
Yeah.
and vocalize my feelings, so that expectations and everything is out there, right? And so that I can also, so that the other person is not guessing on how I feel. So they can be like, okay,
Yes.
she's
Yeah.
tired. She's not going to be of any good to us today.
Yes,
You
I,
know.
I I definitely think it's really important for people to have insight about when they're not feeling their best, and be able to say, hey, it hurts over here.
Yeah.
But I'm going to give you this analogy of the duck, and then you can wrap up if you want. But a duck, when you see them floating on water, right? They look like they're kind of coasting really well, and they look really good. They're coasting, but you don't know what's happening underneath the water. Their legs are paddling furiously, and
Right.
you don't see
Mm,
all the work that's going on underneath the
mm,
water to make them look like they're coasting, right? And so sometimes I say this, and giving them grace, it's all they can do is they're just doing the best that they can. And so it does help. That's why community matters, right? Someone taking that time just to say, hey, I see that you struggling underneath there. It looks like you leaned over a little bit too much that one
yeah.
time, or things aren't going well. Because sometimes they just can't. They don't have the bandwidth to just say, I need help. We want them to get
Mhm.
there. That's why we educate people to have the warning signs, like know what to look for and say something. But clinically, they feel like a burden. They're not going to say anything. And so this is where, again, it really matters to have people checking in on each other. Both ways have to work sometimes, I think, for us to get the outcome we desire.
Absolutely. And I love that analogy, because as you were even saying that, I was like, yes, like, I didn't even think about it. I
Mhm.
want to wrap up with one last point. I am a woman of faith. My faith is so important to me. Um, I know in my culture, and some cultures similar to ours, like even the Hispanic and so forth, it's almost like, let's pray it away. There's a lot of, you're depressed, you're not depressed, or if you're depressed, let's just pray, and
Right.
that's it. So how do you encourage, you know, loved ones who are like, I know I believe in Christ, and I do believe this, he's going to heal you, and I believe he's
Hmm.
going to, restore everything, but you also need to see a psychiatrist.
Right.
I'm gonna
Yeah.
say it like that. That's
Yeah.
probably why they'll come to me. But
Exactly.
how do one not diminish the spirituality of it,
Yes.
but kind of still guide them
Yes.
professionally? Because
Yes.
that's you guys are competing against God.
Well, we're not. We're really not. I do think that, you know, I, I think people see it that way as a competition. Both things can coexist. I think you can have faith and, right? You can have faith and science. And they actually, I think, complement each other very, very well.
Absolutely,
Right. And they're
absolutely.
not in competition. And so faith without works is, don't say the word,
Yep,
faith without works is, right,
yep,
it's not alive. So faith without work, you have to put in the work.
yeah,
You can't just
absolutely.
rely on faith. And I do think that there are some Christians or other faiths who want so much to rely on whatever higher power, but they're not really putting them, empowering themselves and giving themselves agency to help
Right.
fulfill that outcome, right?
Yep.
And so all over the Bible, all over the text, the spiritual text, you have to put in some work. And so you
Absolutely.
have to go see a professional. You would not tell that to somebody who had other medical issues or
Yep.
something else going on with them. You would tell them to do something about it.
Yes.
Right. So same thing with the mental health. Like,
Yep.
of course you should pray. Of course you need to read scripture. Of course you need to
100%.
lean in on your God. And what are you going to do about it? Right. That's the challenge to them. So I love that you brought up that question because I have seen that happen time and time and time again. And that's why I love being someone that can use the dimension of spirituality in my treatment with them. Because a lot of people, not only that, they've lost their way in faith, they feel disappointed
Mm.
that faith did not come through for them. If faith had come through
Right.
for them, why are they feeling like this? So a lot of them
Right.
actually, they need their faith to be restored. They actually don't want to believe anymore. And so we're really having to go through the healing process of building everything step by step again to renew their faith and transform their minds. And it's there biblically, but it can be
Mm.
done. But you have to do it with work.
Absolutely. Thank you. Thank you. We can talk for hours.
Oh gosh, I love talking about mental health. So
You
I
know,
could do this all day, every day. This was
we can
fun.
talk for hours. This has been so, so good for
Thank
me,
you.
and I'm sure for everyone that has tuned in. I truly, truly appreciate your time,
Thank you.
your knowledge, your resources, just being here and just being
Thank
open and sharing. Truly, truly, this has been great.
you.
I'm looking in so many different dimensions with mental health because, like I said, I'm being exposed more
Good.
to a lot
Good.
of things. So I want to talk about marriage, with someone with a mental disorder and
Oh
things
yeah.
like that. So there's so much to come. But Dr. Odom, I am just so blessed to have you on the Health Hub with Dr. T. Like, this is an
Thank
honor
you.
for me. And
Oh.
I truly appreciate you. If someone, and I know you kind of gave your little intro at
Hmm.
the beginning,
Hmm.
if someone was to say, hey, I love the way she's thinking. I love that
Hmm.
she can mix my spirituality and practicality together. And I want to contact her. Can they contact you?
Absolutely.
How can they
Absolutely.
contact you?
So on my page, I don't do a ton of content, but my clinical information is on there to reach out to me. So I have a website. It's gloriaudummd.com. So if you just click on that, it takes you to my site where you can get all of my contact information. You can email me. You can send me a contact form. You can send me a fax. You can send me an email. You could, reach out to me in all types of ways. There's a patient portal there if you just want to get more information. I tell patients we don't have to commit to treatment. You can, call
Right.
me and I have a free 15-minute consultation. I can kind of tell
Nice.
you if we would be a good fit or if you need to go somewhere else. The good thing about the work I do is I am heavily resourced and can kind of refer out if need be to other places. And so even if it's not with us, I hope I'm able to help. But sometimes you need something else that I'm not able to give. And I will you kind of refer away if need to be. So on my site, it's there. But the website again is Gloria Odum, ODUM, MD.com.
Absolutely. And I will be posting her page on my page also.
Awesome.
This live will be available on Saturday on YouTube. And so I'll be sharing it out. Please share it out to someone you don't know who's going through anything and could
Correct.
definitely need to hear these tips, resources, and just advice.
Yeah.
And so I mean, with that, I thank you so much. I am
Thank
just,
you.
I'm hugging you right now.
Hugging you right back.
You
Dr. T,
give the best hugs, so
you
I
are
am
you are
so blessed.
awesome. The work
Thank
you are
you.
doing is so important.
Thank you.
It's not going unseen. You are doing something
Ooh,
very special, really and truly, and what an honor to be a part of it. So keep going. You are shining bright,
absolutely.
and you are
Thank
changing
you.
worlds for the better. So,
I
you
hope
know,
so. I
you
hope
are.
so. I
You
get this
are.
message every week that don't stop. Every time I think like, oh, I'm tired or oh, I don't want. Oh,
Mm-mm.
someone random sends me a text and says, "Don't stop. We see you." And I'm like,
Yeah.
"You do?" And they're like, "We see
Yeah.
you." So I thank God, and I thank my support system,
Yeah.
right? Because
You
I
have an
couldn't do
amazing
this without a
support
community.
for
And
sure.
so thank you so much. I will be
Thank
calling
you.
you tomorrow
No
because I got to
problem.
talk to my TikTok people.
No problem. No problem.
But
Whenever
we
you
will be
have time,
talking
okay?
tomorrow.
No
Thank you
problem.
all so much. Next week, we have a doctor talking about ADHD, moms, wives, and kind of keeping it all balancing, burnout, boundaries, everything that I don't have. We're going to talk about it next week. So I will be the subject next week for her. But thank you so much, Dr. Odom. God bless you. God keep
Thank
you. I
you.
will see
Thank
you
you.
hopefully on our live next week.
Yes, I'll be there.
Thank
Have
you.
a
Bye,
good
my
night, God.
IG family.
Bye
Bye.
bye.